Right. Welcome, everyone. Thank you for coming today. My name is Kiana. I am a graduate alumni relations intern here at Success Works, as well as a master's student in clinical rehabilitation counseling. We have a great set of alumni panelists here to share their experiences and answer your questions on the topic of clinical and mental health. As we go through this presentation, please feel free to type your questions in the chat or use the raise hand feature and we can call on you for you to ask those questions. We're going to get started by asking each of the alumni to give a brief overview of their career path and current role. So that'll be about 3 to 5 minutes for each person, and then we'll open up the floor for questions from students. And we'll start in alphabetical order. So Amy, if you'd like to go first.
Okay, I'm Amylton House. I have a PhD in clinical psychology and am in private practice and live in Freehold, New Jersey, where my office is. And we're noted for our person, Bruce Springsteen lived in our little tiny town and made it famous. I have a bachelor's degree in psychology from Madison. I was there 68 to 71. I graduated early and did a year of graduate school in counseling psych because the PhD program in clinical was always on probation because they didn't do enough clinical work. Pretty soon I realized that I wasn't in the right program, and I transferred into Rutgers PhD program in clinical psychology. At the time, it was the only program in community mental health, and I was interested in that. So I did that, and then I did a lot of volunteer work as an undergraduate. I worked on a hotline, and I was in a women's health collective, and that got me interested in women's health, and wound up doing my dissertation on some psychological aspects of the menstrual cycle, and decided I wanted to work in OBGYN. And back then there were no psychologists in OBGYN. And I had been working at a college counseling center, and then went to worked half-time chief psychologist and half-time in the OBGYN department at a medical center down the Jersey Shore. And then in January of 1984, I left and was full-time private practice. I had a part-time practice, and I've been in private practice since then, and I've done a lot of different things over the years. And a lot of things really started when I was an undergraduate and did volunteer work. And it really exposed me to a lot of different things. I've gone back to school a number of times, and I add specialties. I kind of drop them, I bring them up again. And I keep myself open. Some things that I thought were really going to be a sure thing. There's nobody doing this. I've got it, and nobody wanted to pay for it. Some things I fell into. I helped out. I did forensic work for about 35 years. And one of my colleagues said, oh, there was an examiner in the psychology board who we used to do exams as a final step to become a psychologist, presenting a case. And they said, oh, well, he became disabled and he couldn't come to the board office in Newark. And I said, well, he's not far from my house. I'll come and he can do the exams. I'll do the exams with him. And that started, and I was just helping out. Well, that started me for 20 years. I was an examiner for the New Jersey Psychology Board. I became an expert witness for them, and then became an expert witness before the various professional boards in New Jersey, and also have done psychotherapy, people who are being disciplined, people who have already been disciplined and want to get their license back. And that's the only quasi-forensic work that I still do. I've just really kind of followed my own interests. Some things, like I said, I fell into it. I just kind of, sometimes it was a job and I was making some money, and then all of a sudden I was interested in it, became an expert in it. And that's some things that I've kind of done over the years. I think things are changing all the time. I think you have to keep yourself open. You're not planning the rest of your life. At best, you're planning the next 3 years. I mean, 2 years ago, I had a full-time forensic practice in office. And now, 2 years later, I've got a 24-course certification in telebehavioral health. I'm all virtual and I'm only doing therapy. So, I mean, things happen in life. You never know what happens. And so you have to keep yourself open and, and follow your interests.
Wonderful. Thank you, Amy.
Yeah.
Dan, can you go next?
Sure. My name is Dan Beardmore. I am a pediatrician and I live in Stoughton, Wisconsin, so not far from Madison. I practice in Janesville, Wisconsin, so only 45 minutes south of campus. Went to undergrad at UW and graduated in 2009. Then medical school was in Chicago at the osteopathic school. So I'm a DO. And if anyone has any other questions about what that means later on, we can do that. I got my training done in Philadelphia at the medical center in North Philly called Einstein. Humongous education center for residency programs, and in the poorest zip code in one of the poorest zip codes on the East Coast, and what is technically the most food poor zip code in the US. So that is where I got my first glimpse into the effects of psychosocial factors on physical health, and that informal education has continued as I've returned to practice here in Wisconsin, where issues are maybe different, but still extremely impactful. So I've learned my first 4 years of practice as a pediatrician that what a lot of parents want to come in and talk about are not things that come out of medical textbooks. Sure, I'll see ear infections and I'll see rashes and I'll do vaccines, but each and every day, a huge majority of my patients were talking about ADHD, which stems from parental and home situations, or anxiety, which is a really big popular buzzword right now. Most parents worry that their kids do or don't have anxiety from a very young age. And I'm finding myself talking about just how to parent way more than I thought I would. And that's not something that I learned in classical residency training. So it's been a lot of self-education. So this forum today, I thought would be really interesting if there are people that had questions about my experience or anything that I could share.
Wonderful. Thank you so much. Last but not least, Aisha.
Yeah, so my name is Aisha Rash. I got my bachelor's in arts and psychology from UW in 2008. So it feels just like yesterday though. And I worked at the Wiseman Early Childhood Center for a year working with kids and as a child care provider. And then I ultimately ended up going to grad school for getting my PhD in school psychology. I was always interested in working with kids and, kind of getting at to support them from the school setting. And so I worked out in this, so I did my PhD at Penn State. And then I ended up moving and doing my internship in Portland, Oregon. So I was out there for a couple of years working in the schools, in some dual language immersion schools and classrooms with more kind of intensive pullout for behavior and intellectual disabilities. And ultimately really found myself doing more paperwork than actually meeting individually with kids, which is what I was passionate about. So I ended up pursuing 2 postdoctoral residencies actually in clinical psychology. So one kind of working in the schools down in Janesville, and then another in doing kind of comprehensive psychoeducational evaluations for kids and families. So if parents had concerns about autism, anxiety, ADHD, I was helping to kind of navigate that, and then did a second postdoctoral residency. So that's kind of, the year after you're done with grad school, if you want to pursue your license in psychology, you do this residency. And then I really enjoyed clinical psychology. I did that with UW Behavioral Health at Wisconsin Psychiatric Institute and Clinics, which is where I'm talking to you today from. So I loved it so much that I stayed. And so I work in Madison right by the sleep clinic. And my primary role now is I see kids and families, mostly adolescents. So teenagers and kind of merging into early adulthood, and focusing on anxiety, sports performance, and recovery from injury, and newly functional neurological symptom disorder. So this is where kind of your brain overtakes your body, and you're having your physical manifestations of your psychological concerns. And so, Dan, I'm sure you can, I saw you nodding a little bit, but
We probably shared patients.
we probably do. Yeah. It'd be interesting to talk about. And so part of my work is doing that clinical work. So I see kids in their, for 50-minute sessions, and that's about 60% of my time. Another chunk of my time is spent doing research. So I'm in the Kalin lab. So we focus on subthreshold anxiety across the pre-adolescent period. And so we do clinical interviews with kids and families, and we're writing some papers right now based on our data from the couple of grants that we've been working on with NIH and Vanderbilt. And then, so that's a lot of fun. I get to sort of teach and train kids and families. Well, I work with the kids and the families and the interviews, and then can teach interns, trainees, postdocs on those processes. And so another chunk of my time is teaching and training. So I teach a couple of different seminars to interns. I focus a lot on acceptance and behavioral acceptance and commitment therapy. And so that's sort of a new buzzword, like anxiety is a buzzword, this new approach to therapy. It's sort of in line with mindfulness and DBT, or dialectical behavior therapy. And so I teach and train, I supervise interns, postdocs, medical students, residents, and get to supervise kind of their sessions and the work that they are doing with kids and families as they're training. So I love my job, and it's a pleasure to talk today.
Wonderful. Thank you all for your introductions. We're going to open up the floor for question and answer, like I mentioned previously. So students on the call, feel free to type out your questions or just use the raise hand function. And we'll also ask that you put into the chat your majors and any certificates that you're getting, just so our alumni have a little bit of an idea of kind of the background that students are coming to this panel with.
And is this just a group of undergrads open to like anyone to be joining this, or is this a specific class, or what is the group we have here?
It's open to anyone. So we'll have probably a wide variety of students interested in clinical and mental health. So I can start with a question for you all while students are still thinking. What advice do you have for students who want to go into this field? And what should students be doing to prepare themselves to be successful?
I think one of the things that's really very important is to think about yourself and what your own values are, what you're interested in doing. I tell people, when I was in school, if somebody wanted to do therapy years ago, there were two tracks. You either went to medical school and became a psychiatrist, or you went and got a PhD in clinical psychology, and both programs were very hard to get into. Now there are lots and lots of options. And I think people need to think about what their current circumstances. Can they go full-time to school? When I was in school, there were no part-time programs. There are all kinds of part-time programs, financial considerations. Some programs are easier to get scholarships in than others. And where do you want to live? It's also important, if you have an interest, you don't have to have a specific interest at this stage. But if you do, finding out where those places are located. I think it's very, very important that people don't think that they're planning the rest of their life, because they're not. You're planning something of information you have now. So I think following what your interests are, I tell people to try to get the best training you can get. The other thing I advise people, having been an examiner for the psychology board in New Jersey for 20 years, that it's very important before you invest time and money in a program that if it's a program or a field that requires a license, because there are a lot of programs, especially now, that are online, and they are purposely sound like traditional kinds of programs. And what we found is some people went and may have even gotten a doctorate, let's say, that said clinical psychology, for example. You can get licensed as a psychologist in New Jersey without that degree. But it turned out that the program didn't have the right credentials. So essentially they put all this time and money in, and they went to sit for the exam and they couldn't. It was as if they did nothing. So they had to start all over again. So I always say to people, just double check. If you're not sure, pick a state that you may consider living in, or pick a state, even like Wisconsin, or ones with the toughest requirements like New York or New Jersey, and just run it by the licensing board to see, would this program qualify for somebody to sit for an exam? And there are lots of exams, lots of licenses. And their licenses to get with 1 year of graduate training. So there's all kinds, it depends on what everybody wants. So it's just good to check. Sometimes you can start with something and see if you like it. There are programs where you can get a license, or you can practice with 1 year of training in the field and that may be something that you want to do. You may want to get a job in a facility where they may pay for you to continue with your education. Some people know right away that this is what they want. They want to go for an MD, a PhD, whatever, and they're ready to go, and they understand what's involved. And then I say to people, you get the best training you can get. But there are lots of different ways of getting to where you want to be. As long as the program is credentialed, sometimes you have to be flexible to go to different areas of the country to get your degree. And, if you try something and you don't like it, you can change it. I think that's so important. Don't be afraid of trying something. My first graduate program was a mistake for me. It was very difficult for me to leave. I had never stopped. I didn't not complete something. It was the first time for me to do that. And it was the best decision for me to transfer where I did. But, I think you try things. I still remember things. I still use things I learned in my first program. It's never a waste. Even if you learn, I really hate this stuff. That's good. And sometimes I find I've come back to doing some of the things. I went back to school about 12 years ago, and I was picking up on some of the training I had in my first graduate program that I wanted to extend. So, it's really following yourself. Don't be afraid to take chances, and trust yourself that you'll know if it's working for you.
To get to some of the questions on the chats, I see Delaney, I know you had written the very first question, and I think Amy answered some of your question in there. I would just echo what she said, that everyone's got their own needs based on what you're applying for and what you value. So I agree with Amy's idea to just create lists, and you can use them as rule in, rule outs. No, I would not live there. No, I would not pay this much. No, I need online options. The credentialing is absolutely important. And as you start working through this list, you might start with a huge number of options, but you can probably whittle it down, and then you'd be able to get a smaller number that's reasonable to apply. So Delaney, did that kind of help answer your question? Great.
One of the things that I kind of happened into as well, that I wish I would have known, that I didn't realize until after grad school, in line with what everybody has been saying already, is if finances, because I know this is something that comes up with a lot of kids who are considering, or young adults considering grad school or college, especially now with student debt crisis, that I happened to go to a grad school that was, a larger institution. So I was able to teach and do research, and that kind of I got the stipend and the tuition paid for. And so if you go to smaller private colleges, that sometimes isn't an option, and you end up paying more out of pocket than if you were to go to a larger institution. So luckily I ended up somewhere that did have the research and teaching assistantships, but other smaller places you might not have that option if financial kind of setup is really important to you. Another thing is like, there's a lot of shoulds that you're experiencing with, like, I should go to grad school, or I should make X amount of dollars, or I should have balance in my life. It's figuring out, along with what everybody's already said, like what you truly value, what's important to you, and not necessarily doing things because they look good on a resume. A lot of times grad schools will look at like a diverse resume, and that's a big area of interest, because they know you've explored, you figured out what's important to you, what you want to try, what you're not interested in. And so I think Amy kind of alluded or said it already, like figuring out what you don't like is just as important, and being willing to say, like, actually, this is something I really am passionate about, and I'm taking the risk and following that, even though it's not a slam dunk on the CV or whatever. It's still, you're following what's important to you, and you're not going to be happy in your career if you haven't tested out like what is important to you, instead of listening to what you think you should be doing. So yeah.
Thank you all for answering Delaney's question. There are several more in the chat, so I'll just go ahead and read those off. What is one thing, or what are some things that you wish you would have known prior to entering this field?
I don't know. I think some of it is just really, because I've been the one that's been practicing for the longest time, is just that, to just be very comfortable going with what interests you. I mean, I think one thing to keep in mind, even when you have a bachelor's degree, is there's a lot you can do with it. And, I think that it's really just trusting I'm going to figure it out, and setting my own values about how I wanted my life to be. And the other thing to keep in mind also, I think, is that for a lot of, especially now, it's very easy once you have a degree in a field. Like I notice here, some are interests in nursing. Nursing is a lot of people I've worked with over the years that are doing therapy in nursing. And in fact, in my area, there are no psychiatrists. All the medication is being done by advanced nurse practitioners in my area. I mean, we have no psychiatrists. So, I mean, there's lots of different ways of doing what a lot of other clinicians are doing. And that there's a lot now, even once you have a degree, with certifications. I have a number of certifications in a lot of different fields. And that's really, so it's, even though I did go back to school about 12 years ago, there are many certifications to be able to do what you're interested in doing. And there are also combined degrees. So some things, and it depends, I saw somebody who was interested in forensic psychology. There are some combined programs where when you graduate, you come out with a law degree and a doctorate in psychology. There's some that, are combined degrees with medicine and law, and and psychology and psychology and law, I said. So there are different, it depends on what you're interested in and what's going on. And sometimes you may start out in a program and you get exposed to things that your department or your school is offering that you just never thought about, and just keep yourself open to that. But I think it's really recognizing that the world, especially now, the world is changing so rapidly, and there are all kinds of things that you want, things I'm doing now that I remember if anybody said to me, I was going to early on that I would testify in court. There's no way I would testify in court. And I did it for 35 years. So, it's, and what I did with a lot of things was I got very good training, and I found people who were doing the work I was interested in. I talked to them. I think you have an opportunity here with Badger Bridge to, even after you graduate, to contact people who are doing what you're thinking about, even if you're not sure if you're going to do it. I get people contacting me, just getting information. and asking people questions, trying things out, seeing if there's ways to help somebody out and get a feel for what the work is like. There's just so many different opportunities, and that things are changing, and probably what you're doing now, even at my stage, like I said, 2 years ago, I was doing very different work. So, to be open to the fact that you may be doing other things, and to just not worry about it.
Any of our other alumni have thoughts about things you wish you would have known prior to entering your current position?
I think that Amy made some good points for Alexis with that question there, that when we're in our undergrad and we're thinking about what do we want to do, it's a pretty daunting thought. I'm going to be stuck. It's a common thought. I'm going to be stuck doing this one thing for so long. And I think that Amy and Aisha's experiences have just pointed out that you can be flexible and you can change your mind and you can continue to ebb and flow through your interests and passions. And, in whichever field you choose to go into, if you want to find a specialty or a type of a patient you want to see, or a type of a clinic you want to work in, or a type of a field or locale you want to be. It's funny to say this now, but it's worth hearing, because when I was 20 or 21, I didn't know when I would finally be an adult, be able to make these decisions for myself. And trust me, it does happen. When you're done, when you finish with the education and the training, you can make decisions for yourself and decide what you want to do and don't have to feel stuck. And I didn't know that when I was at your stages. I thought that I had to make this decision in my young 20s that would be my future. And that was a naive thought. And that's what I wish I would have known when I was at your stages.
I think just to piggyback off of that too, not only can you adjust and pivot and not feel like you're stuck, I'm pleasantly surprised every day that the sort of ability to be flexible, to change your mind, to do the different thing or the hard thing or the scary thing, even though it might take some more time, or you might be never an adult. It's that it can get you to, if you're following your values instead of letting your anxieties run the show, you can get to a place where I wouldn't change a single thing about my job. I love my career, and I didn't think, as a kid or even in college, that I would get to a place where I loved what I did so much that it was not just a job, not just a 40 hours a week commitment. It's a time where I can further my development and my learning and have colleagues and the support network. And it's, I never anticipated enjoying what I do as much as I do. And so that is also an option. Not only do you not have to feel stuck, you might also get to a space where you're really thriving and doing what's really important to you. So that's when you just got to take those chances and try something new, or I don't know, do the thing that scares you, or change career paths, and that's all okay. I think, when did adulthood happen? I don't totally know. I think, it's still
It was like 2 years ago for me.
Yeah, I was like,
when I got married and had a
process.
kid, that's when it happened for me.
Yeah, maybe that's the point. Yeah. Okay.
That is
I'll
all
jump
great.
into the next one if that's okay, because it sounds like Alexis's second question is very similar to Manal's first one. What types of qualities or some skills that have been important to help people in our field succeed? And for me, I feel like the patients tell us that they appreciate being listened to.
Mm-hmm.
And, when you're in your training, you're seeking out these degrees, we become experts in whatever it is we go into. And we have so much knowledge and expertise that we want to share. And, this is how you treat it. This is what you do next. These are the therapies, the medications, et cetera, et cetera. And that's what we feel like we have to give. but it's actually the other way around that makes, I think, people successful in mental health, is being able to listen and work with what the patient is giving you and telling you. And I think that listening, it sounds obvious, but if I've explained it right, hopefully it makes sense that I think that's the most important skill, the number one best quality for people.
I completely echo that. Sorry. I would say, not only like listening to people and right, like we have, that is the base, and then we can offer the skills that we've been trained in. And so, yes, college and graduate school is fantastic in learning the material, but it's really developing those relationships, learning how to work with groups of people who may or may not be different from you, and how you engage in those conversations, learning how to navigate just the complexities of being a human in a really kind of wild world is invaluable in being able to do your job well, whatever you might go into. And so I'm thankful every day for like waitressing all through high school and college, because that gave me the ability to communicate effectively with people and get on their level. And so, yeah, you need to know the skills and how to do the thing, and just being a really like, being able to be personable and listen and empathize and be compassionate and meet people where they're at is, I think, one of the most important things too.
And I think what I would add when you're dealing, I think with any of the fields, when you're dealing with people, is it's really important to know yourself. As part of my training is, I had a lot of therapy to really know myself. And I have always found that to be very helpful, because a lot of the people that you're going to work with are going to struggle with issues very much like what you struggle with. And it's important to be empathic and to help them, but be able to separate, to be there for them and listen, but not have your guts all in there so that you can't function and you're not going to be helpful. It also helps you to know what your own limits are, to know what what you can do, to be able to take breaks in life, to have a life where you're doing other things. Because, I think in this field, I think even whether you're a physician or a mental health professional, yourself is like your instrument, and you need to protect yourself and not be afraid to know yourself, and people, and be able to be comfortable with people who may challenge you or ask you questions, and to really understand what are they really saying. A lot of people are really scared, and they have different ways of coming to you, and be able to sit, and it's a special kind of listening, so that you are also protecting yourself as you are there for them. So I think that's important. And it's also important in terms of helping you decide how you want to structure your day, in terms of, what's important. And, I've been in full-time private practice for a long time. And one of the reasons why I did that was when I decided to have a family. And for me, it was very important that I spend a lot of time, with my child. And I was able to arrange my hours around her schedule. And, so I think it's important in terms of what's important to you, and how you want to live your own life. I think it's knowing yourself and not being afraid to say, this is what's important for me.
Thank you. The students have put a number of great questions in the chat, so we're just going to keep going through them. Can anyone speak to the difference between a PhD and a PsyD, and how like compare and contrast the two?
I can. I know a lot about it. First of all, I think there are, like a lot of things in life, there's the abstract notions about what they're supposed to be, and it's what do you wind up doing with it. Traditionally, the PhD, there are lots of PhDs in psychology. Sometimes people think about PhD in clinical psychology, but there are other PhDs in psychology. So it traditionally, in the way it was divided, but it's not always like this, is the PhD, and especially now, with a lot of programs, the PhD programs are supposedly preparing academicians, people who want to teach at the college level. The PsyD and Rutgers had one of the big ones that it was the second one in existence after the University of Illinois. And it was designed to train clinicians, mainly because, like what I said earlier, that there were very few training opportunities for people to do therapy years ago. So there was a need to train clinicians. So the PsyD programs developed, and there were larger classes to really meet the needs of training mental health people to meet the needs of the clients that needed services. Of course, there are lots of people who, are, PhD, programs that do clinical work, and PsyD people who do academic work. So it really, in some ways it's an arbitrary thing. I know one of the things to consider about it, I know here in New Jersey, the PhD program students in clinical psychology are more likely to get the science scholarships. There aren't a whole lot of scholarships in general for the PsyD program. So sometimes, there are plenty of other ways of getting money and different kinds. There are other scholarships and academic scholarships. Somebody had said, you can work at in Rutgers, you can work at the university and get free tuition. I mean, there's a lot of different options for payment. But sometimes when you're making a decision about where you want to go, sometimes it's the faculty who's doing, if you have an interest in something, who is doing it. You can, as long as it's a credentialed program, which a lot of them are, you can still get licensed to practice. That's not an issue. So you have to really look at them. There are these arbitrary distinctions. Traditionally, the PhD programs tend to be smaller. The PsyD programs tend to be larger. So sometimes it's easier to get into them, but it just really depends on where they are. You have to really look at everything individually.
Yeah, I think on the bigger picture, generally, this is a generalization based on anecdata from people that I've worked with. As PsyD programs can end up costing some more money due to the scholarship and also due to like the institution that they're supported through. But they could be easier to get into. And if you don't want to do research or data, like if you don't want to analyze data as part of your job, it's a great path to go down because that's not part of the training. You're really working on your clinical skills. So approaches to therapy, and you get really finely tuned in those. But a PhD, if that's clinical, if it's industrial organizational, if it's sports, whatever it might be, you might have more research component to that, which then could allow more like latitude as you get into your career. If you decide you don't want to just do clinical work, it kind of opens the door a little bit more because you do have that research background. Whereas like a PsyD, you might do more like a theses or papers, but not necessarily like be collecting and analyzing data using like crazy like structural equation modeling or something like that. So that's kind of some other differences kind of in the field.
But sometimes let's say you take that track and you want to do more research, you can do a postdoc, and that's it's never, sometimes you never close out options. There's always options to consider, because sometimes when you're starting out, you say, I didn't know, and then you meet a professor and you say, oh, or you have an opportunity. So there's always an opportunity to pick up some training if you feel that your program isn't supplying what you need. So that's something to think about also.
Thank you. The next question is, how do you recommend students approach professionals like yourself for networking? Perhaps what are some things you like to hear from students or common questions that you get? So
I've gotten quite a few students reaching out through LinkedIn or after the SuccessWorks events, and either if it's by LinkedIn or email, if I've given it to them at one of the events, that's really effective and helpful. It's especially with just like time commitments, it's really helpful to hear like any specific questions that you might have. So if you're reaching out to professionals, being clear in what you're asking for, instead of if you are trying to make the connection, you just say, hey, nice to meet you, you might not necessarily get a response. But if you say, hey, I'm wondering about this, that, and the other, that then incites a back and forth conversation that we or other professionals know what to do with, and we have the capacity to be able to give you an efficient response. I'd also say, even if you aren't sure, just ask. So I've had a lot of people ask of, can I shadow you at your job? And I always have to say, no, I'm sorry, we with HIPAA and privacy, we can't do that. But you're never going to get something unless you ask for it or try. And so if that's making connections, if that's reaching out to somebody, there's no harm in that. And so that would kind of be my biggest recommendation, to have a clear question that you're wanting answered. And don't be afraid to ask for what you're wanting, or say, if you can't help me out on this, do you have any people that you work with that might be able to, or do you have others that you'd recommend? I just got a couple of really great LinkedIn and emails asking those specific questions, and then I could point them in the right direction. Otherwise, it's just kind of vague, and we don't always have the time or the knowledge on how to proceed. But just keep reaching out. It's great. We love it.
I think it's important to ask for a specific time. A lot of us, have appointments by the hour. And so, I think, I know I'm always happy to talk to people, and I get a lot of people through Badger Bridge, but to really try to, ask for a specific time and set up a specific time, because if it's left open-ended, it's not clear, what you want, or any follow-up. So I think that's really very helpful. And I think I think things like Badger Bridge is really a good place to start, because all the professionals in Badger Bridge have agreed to talk to you. And I think it's a little harder. Once you do that, maybe that's your first time. I think sometimes then you can go into some other places like LinkedIn, or I try to help people in terms of other ways to get information if they're interested in kind of a unique specialty, is how to approach people. But I think sometimes it's easier, particularly if it's your first time doing it, to do it through Badger Bridge, because you don't have to worry, oh, well, they're not going to talk to me, or why would they want to talk to me? So I think that's a first step to consider. The other thing I also tell people is to think about going to professionals through people that you know, whether it's family members, people in your community. If you're in a church or a synagogue, go to the leaders and say, I'm interested in this field. Is there anybody here who does this? So start with people that you may know.
Great. This seems like a good time to insert a SuccessWorks plug for the Career Conversations program that we've implemented this semester. I believe each of the alumni on this call today are a part of that. So if after this event you have additional questions and would like to have additional conversations, we'll be sending out more information to students about that program. The next question in the chat is, what are the greatest rewards and challenges of your job? What is most and least satisfying?
Well, I think everyone can imagine that the most satisfying is when you see someone back and whatever we've recommended or suggested has been implemented and has worked. You start someone on a treatment plan, you see them a school year later and they're doing better. And it's not hard to imagine how that would be rewarding. The challenge, I think, is that there's so much that we want to be able to do that we can't do. I have a number of families where the kids are all going through horrible things, mental health sequelae, because they were abused when they were little, or because they spent time in the foster system, or because their family or their parents were poor and homeless. And those are larger problems than I can fix. And I know that that is the root of all the issues. So that's a really, really great big challenge, to feel helpless in some of those moments.
I think exactly everything that you just said, Dan. It's really rewarding seeing when the kids are the people that you work with have these big challenges that they have to overcome, whether that be something that you or they can control or not. Like once they get the skills to get over that hurdle and say, I did it and I'm a stronger person because of it. And this is what I have learned, and this is what I want to take forward, and this is what I choose to kind of leave behind. That is so rewarding as a provider to see that growth. And again, like your limits, you can't remove those hurdles for the people that you work with. You can't erase their history. So it can feel kind of helpless at times. And those are times when you just kind of remind yourself of your limits as a provider. You don't have the capacity to fix anyone, but you do have the skill set and the compassion to support them on their journey. So it's just getting to that point it's a journey for ourselves too.
Yeah, I would agree with those things. I think the probably for me, I mean, I've done a lot of different things in psychology. One of the reasons why I left forensic work, I used to do family court evaluations, and initially I really liked it because I have a strong research and clinical background, and it was an opportunity for me to really combine both skills in terms of helping families, and I specialize in high conflict families, and to see them make recommendations and see them grow. But then over time, after doing it for a long time, things started to change, and people were no longer interested in hearing what I had to say that might be good for the family. It became winners and losers. And some cases I was on, as I became more experienced, were very big money cases. And they were things where attorneys and judges and lawyers made careers and names for themselves. And then it became buying opinions, and ethically, I just couldn't do it. I saw what some of my colleagues did. Like, I do discipline reviews for the professional boards. I saw what happened when people did it. It just wasn't when I talked about values earlier, it wasn't part of my values. And I did not like how I was feeling. And so I made the decision to go for more training and to get out of the field. That, I would say, more so in terms of over my career, was one of the changes. I used to really love doing forensic work, but it had changed so much. And I had to make the decision about what I was going to do. But I think it's also, as I said earlier, in terms of monitoring yourself in day-to-day work, is really knowing what your limitations are, and that as much as people are hurting, there's like the other panelists were talking about, some of their problems are more than what they're coming to you for, and knowing what your limitations are and being in what you can do and what you can't do, I think helps kind of helps you process what you go through in terms of helping people.
Thank you. We have a couple questions that are kind of related to each other. So with the understanding that HIPAA can be a barrier for shadowing and things like that, do you have any recommendations for how undergraduates can get hands-on experience to identify which aspect of clinical versus mental health they might want to pursue professionally?
I can give some examples because I did a lot of volunteer work as an undergraduate. Things I know Aisha was talking about being a waitress. I learned a lot being a camp counselor. I learned a lot. I did a lot of family crisis work, and I learned a lot as a camp counselor, both about working with the kids and working with the parents. I learned a lot. I was on student hotlines. I learned a lot about being comfortable talking to people by doing hotline work. And I was a faculty advisor for a hotline at Rutgers years ago for a student hotline. I would look for those kinds of volunteer experiences. Sometimes I was on the youth council here in my county, and there are lots of organizations that hire people with just a high school degree to work with in underserved communities. And they're always looking, sometimes it's you're doing, helping them with homework, but you're really dealing, like Dan was talking with, you're really getting a feel for what people are like in communities. I think there are opportunities. There's Big Brother, Big Sister program, which I think is a national program where you're really working with somebody and you're assigned to a kid, and they love, I know in New Jersey, they love working with college students who do that. But look for opportunities where you're dealing with people. And there's, I know in a lot of the volunteer organizations that work in the schools, they have all kinds of programs where they're always looking for volunteers. And it's a great way to see what it's like to work with somebody and to see how you feel doing it. I think part of it is a lot of talk in general about finding a field. And I have a lot of training in career counseling to find your passion. I think that throws people sometimes. I think what is helpful to look at is what feels right. What do I do where I just feel like this just feels right. I like what I do, people are responding to me, and it just feels right. And that may be another way of looking at things as you kind of look around at what you do and what you enjoy, is to look at that too. Because I find I get questions sometimes from kids, even on Badger Base, like, how do I find something I'm passionate about? And I think sometimes that throws people. I think it's, what do you enjoy? What would you do if you didn't have to worry about making money or whatever? What would you like to do? And see what are some ways to find out about that. There may be some volunteer experiences, and try it out, see if what it feels like to do it.
I would say too, if the question is mainly like clinical versus mental health, I saw that in the chat. If try your hardest to get into a research lab in undergrad. I know it's a competitive space, but that can kind of give you hands-on experience of what it looks like to work in, if you were to pursue clinical psych versus a PsyD, that might be more in line with what you could anticipate or where you could go research-wise, and what it looks like to actually work in a lab, if that's something that you're considering. And another option that isn't talked about a lot, I didn't even realize it was a thing until not that long ago. A first generation college student, was figuring it out, didn't know all these possibilities, but a postbac is something that after your undergrad you can pursue if you're still not sure that you want to commit to a graduate school or a certain kind of program and you're wanting to get more experience hands-on. You can look into postbac programs in certain areas, and that can give you a year sometime of further expertise in that area before committing to a graduate school. There's also certain kinds of programs that have like a master's in passing. And so if you don't want to say, I'm going to commit 5 or 6 years of my life to this degree, you might, like for school psychology, like you can get an ed specialist, which is just 3 years. And then if you want to stay in it, you can continue on to get your PhD. So there are like iterations of programs and types of training that give you kind of a foot in the door. And then you can continue on if that's something that works for you and that you're interested in. But again, echoing that, like, it's not a final decision ever. There's always additional training that you can pursue and different licenses that you might be able to add on. And it's really, you're going to change as a person as you go through life and as you figure out what's important to you and as you figure out what you hate doing, or, all of those things. So the possibilities are endless, and no decision is final. So.
I know I'm not technically a panelist, but I recently graduated from UW and ran into similar issues. And I think working in spaces where you might not be actually shadowing mental health or clinical health professional, but you're working in that same organization and then are able to build your network and ask them questions that way, is another way that I learned a lot about what I wanted to do in the future. So just something to think about also.
Yeah, it's totally fair to make a relationship with somebody and just say, tell me what your job is like, if you can't like physically watch it happen.
Right.
Yeah, I had somebody that worked in the lab that I work in. She had recently graduated from UW and she was working as one of our lab coordinators. And she talked to me a lot about school psychology and the experience and what that can do. And then she ultimately applied to and got into the school psych program here at Wisconsin. And so getting in the general field gets you like those connections that can change your life. And always just ask to talk.
Mhm.
Absolutely. Thank you. We have about 4 minutes left, and I want to respect everyone's time. So if anyone has any last pieces of advice or wisdom that they'd like to share, please, I'll open the floor for that.
Let me go because I have to leave. I have a client and that I have to set up for my other platform. I think that it's really very important to trust yourself and to not worry about what's going to happen, to just follow things that seem to interest you, get information about different programs, talk to your professors, find out what opportunities there are, and just try something, and don't be afraid to do it. And sometimes if you can't get in, if you want a doctorate program and you can't get in, start with a master's degree. I mean, it's, and transfer in or see what you can get into. And you can always transfer. It's a lot easier also to transfer into a program than when you apply for the first time. So there's lots of different ways of getting to where you want to be. You just have to keep trying. And sometimes if you don't get in the first year, you can also apply the next year. And that's what sometimes people do. I've known people who applied for departments 4 years in a row till they finally got to the program that they had their heart set on. So those are options also.